Hi, I'm Dr. Corey Campbell, Omaha Spine and Support, and if you're watching this video, you've probably been prescribed this exercise or something like it, and it would be based off of the assessment that we did in our first visit. So the reason you're getting this exercise is because we've determined that there's some sort of foraminal encroachment, or the nerve root is being compressed, or there's a disc herniation or a disc bulge, depending on what kind of referral you've gotten here or what we talked about. You're going to hear all of these different things, or you've read these on some of your MRI reports. But what we determined during our exam is that when we put you into extension, that takes away the pain that's going up your leg or into your back pocket or into your spine. And so the goal of this is to give you that relief from the down the leg pain, or the numbness and the tingling, or the sharp stabbing pain that you're getting, depending on what it is that you have as your primary issue. And so you've probably already been walked through this, but this is a good way to remind you of what to do and also give you a little bit of prescription on number and frequency. So if we put you into this position, it's taking that disc herniation and moving it towards the center. I probably already talked to you about this, but that's what we're doing. We're putting you into a position that allows the disc spaces to open, and if we do that repetitively, or we use respiration like I'm going to show you here, then we can actually take that jelly-filled center and move it from the outside part that's creating the bulge and laying on the nerve root to the inside part, which will help you get that nerve root freed up so that it doesn't have that compression. It's not being pinched, so to speak. And so there's a couple different ways to do that. We probably went through a number of different ways. You can do these standing, seated. I'm going to show you the ones that we most likely did on our first exam here. So you'll find a piece of floor, bed, or couch most likely. We're going to want to do this on a bed so you don't have to crawl up from the floor, because then we typically want to bend forward, which is what creates that compression in the disc, which allows it to herniate or bulge onto the nerve root. So first, I basically would like you just to make a double-fisted pillow. So one fist on top of the other, let the elbows come out, put your chin in it, and then I want you to breathe into the belly. So we're going to breathe into this part of our stomach. I want you to fill that whole balloon full of air. I don't want any breathing up into the upper traps or the shoulders. So we just take a nice easy breath in, fill that balloon up, and then we breathe out like we're blowing through a straw. We're going to do 10 of those. So you're going to take 10 of those balloon-filled breaths, followed by a breathe out like you're blowing through a straw, kind of a forced exhalation, but don't get crazy with it. So just breathe out like you're blowing through a straw. We're going to do that 10 times. That's going to create extension. So that's going to help us get more extension in that low back, which is going to take that disc and move it towards the center. So we're here, double-fisted pillow, nice easy breath in. We're breathing into the stomach from basically the rib cage down and into the bed or the couch, or in this case the table. And then we breathe out. We'll do 10 or so of those. After that, we always want to monitor to see if we've gotten rid of the leg pain or the sharp stabbing pain that's going down the leg, or the numbness or the tingling, whatever symptom it is that you're experiencing. The progression from that is to put your hands under your shoulders, and we do these press-ups. We can do anywhere from 10 to 30 to 40 of these, and we can do these as often as we like, especially in the initial phases of treatment, in order to control the symptoms. Now obviously we're going to be working on the reason why that disc herniation is there, and so we're probably working in areas that aren't involved directly with the disc herniation. We're treating those areas of dysfunction above and below there, which ultimately is what's going to allow you to not have to do these for the rest of your life. But this is a good way to treat the symptoms while we're treating the dysfunction. And so we can do 30 to 40 of these, up to 30 to 40 of these 3 times a day. When we get up, we do want to drop a leg off. We want to come straight up. We want to sit here, and then we want to hip hinge. A good way of thinking of it is reaching towards the ceiling, or that sumo squat position, and we come straight up. What we don't want to do is we don't want to do this and throw ourselves up. So I hope that helps. Again, we want to do the double fisted pillow with breathing first, because respiration sets the stage for everything. Then we can move the press ups, and then when we do get up, we want to do a hip hinge, which is here, straight up, reach for the ceiling, come straight up. Not do this. We don't want to throw ourselves up here, because that flexion is what is going to compress the disc as well. I hope this helps. There's more videos here on our YouTube channel if you need or have any other questions about other conditions. I hope this helps you. Thank you so much.